Hi there, my name is Meg. I am one of the accredited practicing dietitians here at Empower Healthcare, and a key area of dietetics that I'm really passionate about is gut health. Now, you may have heard of this term before, but what actually is it? So there are so many definitions out there for gut health or what makes a healthy gut. You may have heard things on advertisements like a healthy gut is one that has a good balance of microorganisms in the gastrointestinal tract. And you'd be spot on, that's correct. But the way that I like to look at a healthy gut is one that works for you. So my gut is going to be different to the person next to me. We all have different guts, but the key thing that a healthy gut should have is one that doesn't cause you discomfort or pain across the day. So what does a healthy gut look like? I find it easiest to actually look at what an unhealthy gut looks like. So someone whose gut might need a little extra attention might be experiencing things like bloating or cramping or abdominal pain. They might also have constipation, diarrhea, irregular bowels. They might also have nausea. Things such as brittle nails or hair falling out are also signs that there might be something going on with the gut. So something that's really important is that these symptoms shouldn't be dismissed as, oh well, like that's just my body. It's really important that clients tell their case managers, I'm having these symptoms, and case managers organise a referral to a dietitian. We will work with the client to find out what's going on and get to the bottom of the reason to help improve their quality of life and also enjoyment of food. So what's actually happening and what is the cause of these symptoms? The list is extensive, so I won't go through it all today, but to give you an idea, it could be an allergy or intolerance to food. It could be your body just struggles to digest some specific types of foods. It could be the way that you're eating. So are you eating rushed on the way to work? Are you eating in a meeting at work or in a stressful event? That can affect your gut. Even things such as, are you trying a new medication or have you started a new medication? Is that giving you side effects? That could potentially be giving you the gut discomfort. Something else could be, do you have an autoimmune condition, which means that you were born with it, but it may not have been triggered until recently. So foods that you might have been able to eat in the past, you can't eat them anymore. So yeah, these are all things that we will talk with you and find out what's going on to figure out how we can help you best. So you've got a referral to see a dietitian. What's next and what's actually going to happen in the appointment. So we'll come out to you and we will do a bit of a general medical history to begin with. So we'll find out what health conditions you've had currently and in the past, what your family medical history is like. So has your mum had these same sort of symptoms as well, or your dad or siblings? Do you know if there's bowel cancer in your family, or do you know if there's Crohn's or celiac disease in your family? All of these things will give us a bit of an idea. We'll also find out things such as your day-to-day life. So, where are you working? What are you doing? Is it a stressful job? All that sort of stuff. Exercise, even down to how much fluid you're having and that sort of thing. We'll also want to know medications you're on, and that's sort of the beginning of the appointment. We'll then go into the fun part, which is talking about what you're eating, and so we'll want to know, what are you having, brekkie, lunch and dinner, morning tea, afternoon tea, desserts, and everything in between, as well as drinks. So we'll do quite a thorough diet history in the first appointment just to get a good idea of what's going on. So we have all this information, what's next? It's really about figuring out what the next best step is for you. So it could be something like putting you on a low FODMAP diet, which is a specific diet that allows us to figure out if you've got any intolerances to certain foods. We might get you to go to your GP and get some blood tests to see if there's Crohn's or celiac or something else going on. We might look at your fibre and your fluid intake, see if that's going well. Portion control, so some tips around how to ensure that you're not overeating or undereating at your meals, which can also impact your digestion. We might even ask you to keep a food diary, which is literally how it sounds. It's a diary of your food where you note down everything you eat, and then also note down your symptoms. So we can get a bit of an idea of, oh, they ate this food and got these symptoms. Let's have a bit more of a look into it. The most important thing I want to make clear here though is that you're in control of your care and it is up to you how you want to move forward. We'll work with you, we'll give you suggestions, but it's up to you into how you want to move forward. And we're never the food police. We're never going to tell you you can eat this and you can't eat that. It's all suggestions, and that's the most important thing. So case managers, if you think that your client would benefit from seeing a dietitian because of gut health issues, please reach out. Give us a call on 13000 HELPU. That's 1300 043 578. And you can ask us questions and see if a referral to a dietitian is right for your client. Thanks so much. Bye.